All right, everybody. I am super excited for this portion of the symposium today and glad that you all are back with us. I know I've learned a lot. I hope you have too. This afternoon, we'll get, like I said, a little more targeted towards our 10 Southeast counties and some of the challenges that we face with healthcare and access, and some of the good stuff. So the first speaker is Glenn Czarnecki, who is the Regional Director of the Tennessee Department of Health's Southeast Region. He has spent most of his career in public health, starting as a health council facilitator in the mid-90s. The Regional Emergency Response Coordinator in the early 2000s and Assistant Regional Director for about 2 years, and then came on as Director in Regional Director in 2005. He has a Master's in Public Administration from UTC, another Go Mocs, and he served in the Tennessee Public Health Association in various capacities. Thanks so much for being here, Glenn, and we're excited to hear what you have to say.
Well, thank you for having me. My presentation is going to be sort of introducing the Department of Health and sort of how we're organized and talk about some of the services we provide. Public health in the state of Tennessee is very unique in a lot of ways, and I'll get into that as we go through the presentation. We do have one of the largest departments in state government. I think that we're well over 4,000 employees now. I think that number is probably a little dated. Our mission is to protect, promote, and improve the health and prosperity of all people in Tennessee with a vision of healthy people, healthy communities, and healthy Tennessee. So the way that the Department of Health in Tennessee is organized, there's on Tennessee Code Annotated, the law states that every county in the state of Tennessee will have a health department. There are 95 counties in the state of Tennessee, and so there are 95 county health departments. In some larger counties, there can be multiple sites. I'll talk a little about the Southeast region in just a minute, but we are basically broken into 7 rural regions and six metropolitan regions, and I'll show those here. So if you were, if you're in your MPH program there at UTC, I'm sure you've learned the difference between centralized and decentralized health departments. So our metro health departments are decentralized, and there are 6 of those in the state of Tennessee. So you got your 4 big cities, of course, Memphis, Nashville, Chattanooga, Knoxville. And then up in Tri-Cities area, there's the Sullivan County Health Department, and out west, the Madison County Health Department, which is in Jackson, Tennessee. They are decentralized. In other words, they are sort of independent health departments that work with the Department of Health and actually function typically through some fairly large contracts with the department, but they are sort of they are managed still by their local county government. So my counterpart in Hamilton County, Sabrina Novak, works directly for Mayor Wamp, the Hamilton County mayor. And that is true of all the 6 metropolitan health departments. You're going to find those service-wise that they pretty much offer the same thing as we do, again, because they get these large contracts through the department to provide some of those programs, but they're a little bit independent. The rest of the state then, and the other 89 counties are really centralized health departments. In other words, they are a true sort of outreach of the Tennessee Department of Health. While we work with our county governments to provide additional staffing and things along those lines, we still answer directly to the department. So my boss is the Director of Regional and Local Health, and she is in central office. So all of our authority kind of comes from our central office in Nashville, but I have 6 counterparts across the region, and we meet quite often to discuss, policies and procedures, guidelines, different initiatives that the department is taking on, and kind of how to manage those initiatives at a local level. So it can be a little confusing sometimes. I was telling Christy just last week that my parents still confuse me with someone who runs a metropolitan health department, but like I said, there is a difference between the two, and I wanted to explain that. As far as the Southeast region goes, probably the thing that makes us the most unique is that we are the only rural region in the state that is actually resides in 2 time zones. So we have 5 counties in the central time zone and 5 counties in the eastern time zone. And people always say, well, gosh, how do you keep all that straight? Well, we just communicate both time zones whenever we talk about any kind of meeting or anything like that. So if I drive west, I can almost go back in time. I've said many times that I can make a really bad decision at 8 a.m. in Chattanooga and fix it by 8 a.m. in Dunlap. So I guess that's kind of one other small advantage that I have. But we cover about 330,000 people. Interestingly enough, that is very, very close to the population of Hamilton County as a whole. So our 10 counties are equivalent to about the population of Hamilton County. Bradley is our largest by far. They have over 100,000 folks in Bradley, a population of over 100,000. McMinn is probably our next largest. Franklin after that, Ray, Marion are pretty similar. Then we have a lot of very small populated counties of about 12 to 15,000. Polk, Meigs, Bledsoe, Sequatchie, and Grundy really kind of all fall into that category. So we have a real range of facilities, a real range of staff size, but services are pretty consistent. I'm going to talk about those real quick. So a lot of times folks know us for things like immunizations, family planning, and so forth. And I won't go through all of these, but this is just some of the services that we offer at your local health departments. And I wanted to highlight just a couple. A few of these are new. Some of these we've been doing for a long, long time. The school-based sealant program. This is a program where we hire hygienists to go out into the schools and do dental sealants on children's teeth. Of course, we seek parental consent for that first. But it's a very low cost, very benign process that really allows a lot of our children who are in some of our rural counties who rarely get an opportunity to see a dentist, for us to just take a look at their teeth and then, seal those teeth to prevent future dental cavities, even to slow any cavities that have actually been formed. And we've actually been doing that in our region for decades. And that's not a program that most people would be aware of. Highlighted voter registration. You may not know that you can go to your local health department and register to vote. And that seems more and more important all the time. So wanted to make that a special highlight. Gifts vouchers. This is a program that we started actually in Southeast Tennessee some years back and is now offered in every health department. Well, I know every rural region across the state. I think most of the metros offer. I know Hamilton County offers it as well. Gifts program is a program to help pregnant mothers to quit smoking. When we first started the program over 10 years ago, we had some of our counties whose pregnant population, whose pregnant mothers their percentage of smoking was over 40% when we first started. And we know that if moms smoke throughout pregnancy, there's a dramatically higher risk of low birth weight and babies born early and all sorts of potential problems down the road. So with that program, we offer vouchers to help mom quit. We give them a couple of counseling sessions, and we've had many, many mothers successful in that program. We're really, really proud of that. Telehealth is something that kind of came about around COVID, but we've continued to offer telehealth in a lot of our different programs. Our WIC, our supplemental nutrition program, WIC, that most of you are probably familiar with, is something that you can pretty well do almost exclusively on telehealth. We have primary care visits offered that way, even some family planning. And so we're trying to utilize that technology as much as we can because a lot of our patients have a hard time with transportation. And then lastly, I wanted to highlight naloxone. We now have naloxone at all of our health departments. Someone can walk in off the street, no questions asked, and get that given to them at no charge. So we're trying to have a significant role to play in that sort of epidemic. these are some additional services, and this is probably where the Tennessee Department of Health is really unique. You're not going to find a lot of health. Well, in fact, you're not going to find any health departments in the United States that offer primary care. And we started offering primary care in around 2006 when TennCare just enrolled about 200,000 enrollees, and we became a part of the safety net. So we provide primary care to those that are uninsured ages 19 to 64. Our departments also, many of them offer dental for both adults and children. I believe we are also the only health department in the nation that provides dental care. We are getting into more and more the mental health field. We've got some partnerships with volunteer behavioral health in bringing navigators into our health departments. We've started some substance misuse navigation, trying to help folks get to the care that they need. And we're also very soon going to be talking about some dementia navigation, especially in Bradley County, our largest county. We're excited about being able to offer that very soon. And I wanted to talk a little bit about what are really what we call the three core functions of public health. And we're going to be talking about some of this stuff a little bit generically, because some of these services, all of these core functions fall under what we call the 10 essential services of public health. So each core function has a number of those essential services. And I want to just highlight those a little bit. And what I'm showing you in red are the types of positions that we hire under these particular services. I thought you all might find that interesting because I know we have folks from a lot of different backgrounds. And at the end, I'll show you a slide that kind of goes through all the different various positions that we offer. The first core function of what we do in public health is we're constantly assessing the health of our community. So we do that by monitoring the health status of our communities through various means. Behavioral risk factor surveys you all probably heard of. We do community health profiles, community health assessments with our health councils. We gather a lot of information, vital statistics, the birth and death information, disease registries, and so forth. And then our department hires numerous epidemiologists. We only actually have one epidemiologist in our regional office, but our central office has many epidemiologists. And we're constantly running numbers so that we can tell, we know at any given time what the leading causes of death or disease are for any level of the population. So we have a kind of keeping a constant watch on the health of our communities. We also do that through diagnosing and investigating health problems. Most people know that Department of Health gets involved if you have like foodborne outbreaks and things along those lines. And so we have infectious disease nurses that get involved, that talk to folks and try to do some contact tracing and things along those lines, so that when there is an outbreak, we can typically figure out how that started, who all's been affected, and so forth. The second core functions is really the role that we have in assuring that people stay healthy. And I'm going to highlight what we call our environmentalists for our local health departments. These are the folks that go out and do your restaurant inspections, swimming pools, hotels, things along those lines. Trying to be sure that the food that is offered every day by private restaurants is safe and healthy. We also have a role. I'm sorry, Chris, did you say something? Okay, sorry. We also have a role to play in tuberculosis. Now Christy is talking. Can you all hear me?
Yeah, we can now. Yep, you're good.
Oh, did I cut out?
You did for just a second, but you're back now.
Okay, sorry, it must be our network.
That's good.
Of course, we have a role to play in things like establishing quarantine, tuberculosis control, and those type of things. We also have a significant role to play in linking people to health services. I mentioned primary care, I mentioned dental. Those are two examples of services that we provide, quite honestly, because there's a shortage of those providers. And so oftentimes the Department of Health will step in if there's a great need out there. I mentioned, and here's where we employ physicians, nurse practitioners, dentists, social counselors. We have a whole home visiting program where we deal with at-risk families and try to help them. So We're hiring social counselors as well as part of that assurance role. Continuing on with assurance, we assure a competent public and personal healthcare workforce. We do that through our quality improvement programs, through our nurse trainers. The Department of Health actually licenses anyone who has a medical license within the state of Tennessee is licensed through the Department of Health, and it's a large division of our health departments. We evaluate programs that we offer and other programs just to be sure that they're being effective. And then often we do some research as well into some new and innovative solutions. I mentioned MPH graduates. That's probably the most appropriate role for them coming into our health department, is to have a role in that assurance function. And then the last core function is really what we do around policy development. And here's where we hire health educators, what we call health promotion or community development staff. These are your folks who go out and facilitate health councils. They get sort of the grassroots efforts going. They're informing our communities about the various, statistics and things that the various diseases and conditions that affect the overall health of their communities. We empower them to try to make their own decisions and put together programs that actually, can improve their overall health. And then on occasion, those health councils want to bring about some change in legislation. And so we actually have, a whole division of attorneys that work for the Department of Health as well. And they work on various types of legislation. The Tennessee Non-Smokers Protection Act that went into effect, I think it's been about well over, it's probably been 10 or 15 years now. They took all the smoking out of, public restaurants and all. That was significant legislation that was brought about from sort of grassroots efforts, people that were interested in public health, that really wanted to protect the non-smokers in the state from having to be exposed to those kind of things. That's a great example of that core function. So that gives you kind of an idea of, sort of the main focuses of what the Department of Health does. I went ahead and summarized all the different positions that we typically employ. So, in the regional office, here in my office in Chattanooga, we have nurses, we have doctors, we have dentists. We have a whole accounting, group who does our billing, social workers, of course, our nutritionists work in our WIC programs. Emergency response is a significant role that we play. Of course, we have to have IT staff, and we have folks like me, the administrators. And then, of course, at a local health department, kind of the same thing. You've got a county director who runs each health department. That's their administration. But then you've got nurses, nurse aides, doctors, dentists, and so forth, all the way through health educators, even maintenance and janitorial. We actually have bricks and mortar in every county, so there's always significant work around maintaining those buildings and keeping them clean, things along those lines. All right, just wrapping up, I wanted to show our core values. This is the core values established by our region. We use the acronym MERIT, mainly to help older guys like me remember what the various letters stand for, but it's mutual respect, excellence, responsiveness, integrity, and teamwork. We feel like if we embody these 5 values, that we'll be being the best stewards of our taxpayers' money and providing the best service we possibly can. If you're interested in the Department of Health, just some of the benefits: 12 holidays, including Juneteenth was just added a few years ago. You get 1 day of sick leave and 1 annual each month, and that increases with tenure. Educational support means you can go back to school, and the state will help pay for that. TCRS is Tennessee Consolidated Retirement System. It's one of probably the few retirement systems that are left anymore. We do make market adjustments on occasion to salaries. And then lastly, of course, just the joy that comes from knowing your work impacted someone's life positively. And we take that actually very, very seriously. We always say that just about anyone who works for us could probably make more money doing something else. I hope that doesn't crush your hopes and dreams. I really doubt many of you went into this thinking you're going to be millionaires, but you can certainly make a very good living. I've been with the department now about 27 years. Once I hit my 30 year, that is when things like longevity and all kind of wrap up. But it really does get in your heart and soul, knowing that you can leave work every day, that knowing that you positively impacted somebody's life. We have a lot of nurses, a lot of health educators, and doctors and physicians and all that kind of look at it. We often say that it's like doing mission work right in your own backyard, and that's really the way we look at it. So that is my presentation, and I'll turn it back to Christy to see if we have any time for questions. Thanks.
Thank you so much. That was outstanding. And I agree. It is a mission for sure. And this is public health is one of those areas that are so important and really kind of the thread that binds us all together behind the scenes. We will be sure to get this information out like all the other presentations so that if you have questions, you're more than welcome to get a hold of Glenn or interface with one of your local health departments as well. Thank you so much for being here and helping us with this.
Thank you, Christy. Appreciate it.